It's Sunday, June the 21st. As of yesterday, the cumulative number of confirmed COVID-19 cases in South Africa sat at more than 92,000 cases. The mortality rate is 2%. Cases in Gauteng are increasing at 11% per day. That's compounded. Offer anyone that return on an investment and they will scream Ponzi scheme. But here we are. With more and more active cases, many people have been forced into quarantine and many more have been exposed. With that, we have also entered a relaxed level 3 lockdown. I'm Howard Feldman. This is the Synthesis Sunday podcast. Happy Father's Day. COVID expert, Liverpool fan and father, Dr. Anton Meyberg. Good morning. How bad is it?
So good morning. So before I start, I'd just like to wish my own father happy Father's Day. Miss you, can't be with you today due to the silly COVID virus going out there, but just know that we're thinking about you today. Going to the numbers, and the numbers are very important so we know exactly what the trends are doing. There are currently 8,931,000 cases worldwide, with 467,000 deaths and 4.7 million cases resolved. The United States has 2.3 million cases with 121,000 deaths. And South Africa, as you said, is 92,681 cases with 1,877 deaths. There was an increase of 4,966 cases yesterday. Gauteng are sitting on 18,978 cases. Western Cape are sitting on 50,000 cases, and Eastern Cape are 14,000 cases. The numbers in Western Cape are not going to reflect truly because they are not testing enough people in the Western Cape at this point in time, because they are only testing people who are sick, over the age of 65, people with comorbidities, and healthcare workers due to lack of tests. What's very interesting to note is that if we look back to the 22nd of May, at that stage, there were about 6,000 cases a week. 29th of May, 9,000 cases a week. 12th of June, up to 18,000 cases a week. And in the last week, more than 25,000 cases. The cases are ramping up exponentially. We are seeing many more cases in Gauteng. We are seeing many more cases in the country. This is what we're dealing with at the moment.
So we know that we've moved to level 3 advanced, level 3 master level 3 plus, level 3 supersized. I'm not really sure what it is. We are told that cinemas are now allowed to open, restaurants are going to be allowed to open, personal care. What was your reaction when you heard about this? And do you think that this is making a big difference to the numbers that we are seeing?
So my reaction was this. I don't know what to say. I don't know what the thought process, barring the economic thought process, but from a medical thought process, this is a disaster. It's going to cause pandemonium. It's going to cause complacency. It's going to allow people to go out and not protect themselves. Once again, this morning I went for a run, and I think I saw 95% of people without masks, including fellow colleagues, fellow doctors, other people who should be responsible, who should be wearing masks, yet no one is wearing masks. We are in for a landslide. We are going to be totally decimated if we do not wear masks and we do not look after each other. We have to stop being selfish.
All right, tell me what you're seeing in the hospitals and what hospitals around Gauteng are seeing at the moment.
So the numbers are screaming up in Gauteng at the moment. Okay, we've got over 600 people admitted into hospitals, over 150 people in ICUs. Many more people are being ventilated. There are a lot sicker people coming in at this point in time, and there are a lot more admissions happening at this point in time. When we look at the hospitals, each hospital has got a certain amount of wards that are dedicated to COVID. So in other words, you can have 4 COVID wards with 2 PUR, people under investigation, 1 ICU ward, and 1 general COVID ward. What's happening now is the general wards that are used for elective things are now starting to close and starting to open up for other COVID cases. So we are getting fuller, and our capacity and ability to do elective cases is going to shortly be stopped.
All right. Many of us now know of friends, colleagues, people that we work with in all sorts of areas who have been tested COVID positive. Can you take us through what we should be doing once we've come into contact, and what is contact? If I walk past a person in the street and we both masked, Do I need to go into quarantine? Can you just take us through that? Because I know that this is a lot of what you are dealing with as more and more people become positive.
So I think we've got to take it a step back and discuss the stigma related to all of this. If you have been diagnosed as being positive, if your COVID-19 test is positive, please do not hide the fact that you're COVID positive. The implications of hiding the test are far-reaching because you can spread it to other people without them knowing. There's no stigma. There's no bad thing. We need to know, we want to know, A, so we can help you, and B, so you can prevent the spread to other people. Now, if you come into contact with someone who's COVID positive, the essential ruling is that you need to be in a contact space with them for about 15 minutes, even if you're wearing a mask, and worse if you're not wearing a mask. But then you're considered primary contact. At that point in time, we will isolate you for 14 days. There's no need for you to have a test. Tests will start running out. If you become symptomatic, if you get a fever, cough, short of breath, then by rights you can go for a test. But even if your test comes back negative, you are still going to isolate for that 14-day period. So in reality, there's no reason for you to be tested. Stay at home for 14 days, and people who are living with children or have got other people in the household will need to isolate the whole household unless you can safely go into a cottage on the property and stay away from everybody. So you will need to isolate for 14 days.
Right. And if somebody is COVID positive, they're living with their family, is there value in them going into isolation, or the fact that they've already been living with the family?
The family has to stay in isolation with that patient because there's no point in them going away from, no, but they don't have to put the person in a cottage. The person can stay with the family because they've been with them for the last few days when the symptoms developed. So in all likelihood, if they're going to get it, they will get it. And there's no point in now separating them 3 or 4 days later after the symptoms have developed.
Is there value in testing the whole family once they're living with somebody who's COVID positive?
No, there's no value in testing the whole family unless someone gets extremely ill, because at the end of the day, like we said, you're still going to isolate or quarantine the family for 14 days, regardless of what the test result shows. So if you've got one positive test in the house, you don't need to test anybody else in the house unless they are symptomatic and really ill.
So just define that, because let's say somebody is COVID positive in the family, the child gets a fever, nothing serious, but let's say moderate flu-like symptoms. Should they be tested?
You can say that is most likely going to be COVID, but there's no reason to test them because there's no implications of testing the child if they're going to be staying at home in isolation anyway.
And a listener on Twitter wants to know, how do we treat somebody at home? Somebody who's got mild or moderate symptoms. Do we nebulize? Do we give them steroids? Or do they just take Pneumonia and treat this symptomatically?
So the treatment of choice for home care for somebody who's not completely unwell is Pneumonia and is vitamins. We don't nebulize. And the reason why we don't nebulize is because if you do have the virus is droplet spread, which means there's large droplets that drop to the ground. Once you bring in a nebulizer, it aerosolizes the virus and makes it airborne. And that can stay in the air for a few hours. So anyone who walks into the room can then be exposed to the virus. And that changes the whole dynamics of the whole virus. So we don't nebulize. We don't give prophylactic antibiotics. We don't give prophylactic anticoagulation, no warfarin or anything like that. And we don't give cortisone treatment either.
Right. So Philip wants to know what's the difference between droplet infection and aerosol transmission. Are they the same thing? You just explained that they're not.
Right.
And that's why we
basically, I think what's important is COVID is a droplet spread virus. You cough, you sneeze, the virus then drops to the ground, where the difference between tuberculosis or chickenpox, those are airborne, aerosol generated. You can walk into a room after someone's coughed and it still can be in the air for up to about 6 hours. And that's an aerosol or an airborne virus.
Roxanne wants to know, what advice does the doctor have for eating in restaurants besides social distancing? How safe is it to eat in the restaurant using their cutlery, etc.?
So if you're asking me, which you are asking, I would say get takeaways. I don't understand and I don't see how it's possible to sit in a restaurant without a mask and not get exposed to a virus. Someone's going to cough, someone's going to sneeze. Even if you're a meter away, there's whole different types of interaction. It's safer to be at home. It's safer to get takeaways For me, I personally am advising no one in my family to go sit down in a restaurant at this point in time, especially with the escalation in Gauteng, especially with the cases sparking, rather get takeaways.
One of the things that a lot of people have mentioned to me when I've spoken to them after a positive diagnosis is that there's a tremendous amount of fear around this, because they might not be feeling terrible at the moment, but the what ifs and what about tomorrow and what about a few days' time. How long do the typical symptoms last in a moderate or mild form before people can actually relax about it?
So there's a term called Coronaphobia, which is the fear of corona. And
I have it.
I think we've got to look at the bigger picture.
Not corona. I've got coronaphobia.
I didn't say hypochondriasis, I said coronaphobia.
Is that different?
Yeah. Different, right?
Oh,
so
sorry.
You've got to look at the whole virus, and you've got to look at the bigger picture. The entire world is being exposed to this now. More than 85% of the world is asymptomatic or is got very mild disease. The further 10% gets moderate disease, and only 5% gets severe critical disease. So if you get corona, it doesn't mean you're going to end up in ICU. A very small proportion of people will get sick, but those are the people we're trying to protect, because it's a rapid, progressive spreading virus, and it spreads very quickly, and it can affect people very quickly. And those are the ones we're trying to protect. So if you get the virus and you're staying at home, you've got to watch for symptoms. You've got to watch how you're feeling, and you've got to be in contact with your healthcare professional to understand what the symptoms are, to understand if you need to escalate anything or if things need to be done. You don't need to sit at home and panic, wait for day 1, wait for day 2, wait for day 3. Take your vitamins, take your Panado, make sure your fluids are up, and just look after yourself. And over 85% of people will be okay with this.
Yeah, Mandy says, I'm feeling very anxious about all the new cases. I think many of us are, because it's around, it's here.
You know, there was a study that I heard from Professor Schub at the Imperial College in London that said if 50% of people wore masks, there'll be a 50% reduction in the spread of the virus. We don't even have 10% of people wearing masks at this point in time. If 50%, that's all you need, 50% of people just to wear their masks, we would cut down the spread of the virus in Gauteng dramatically, and in the country and in the world.
Which leads me to Baruch's question. Are we seeing such a big increase because of irresponsible behavior, or is this likely to have happened in any event?
People are being irresponsible. People are being selfish. People are still having play dates. People are still having social interactions. They're still having dinners. People are going out not wearing masks. So we are seeing a spark due to people not taking care and not taking the correct precautions. Hand washing, hand hygiene, social and public distancing, masks. These are the most important criteria that we need to do and put up and make sure that everyone follows these rules.
Dr. Linton Lurie says, please can you ask why if the incubation period of the virus is 14 days, there appears to be a distinction in the current recommendation for the length of quarantine, i.e. 7 days quarantine for a low risk, partially protected or protected exposure versus 14 days for a high risk or unprotected exposure. Surely it should be 14 days for all.
So we go by the CDC and NIC.
Right. Can you just explain?
We go by their things. Yeah. So basically, he's saying, can people have a shorter quarantine period of 7 days if they're at a lower risk, or do they need the 14-day quarantine if they're at a high risk? And it's a blanket rule as of now. It's a 14-day quarantine. There's no 7-day quarantine. The only people who undergo a 7-day quarantine are doctors or nurses who are wearing PPE, that's personal protective equipment, that are masks, visors, the full hazmat, Ebola suit, etc., that may have been exposed, and there's minimal chance of them getting exposure due to them wearing the correct things. Those are the only people that are allowed to return to work after an 8-day period. They are asymptomatic. 4 days rapidly, it is spread excessively, and the numbers are sparking. We are not holding by a 7-day period even for low exposure. We have to protect everyone around us.
Okay, and Pierre wants to know, is there any merit in doing home breathing exercises to treat or manage lung problems as suggested on a WhatsApp video doing the rounds? I haven't seen this video, but does that make any sense?
Yes, I've seen it, unfortunately, and they don't make sense. You know, just look after yourself. There's myths, and, you know, it's one of those, you know, hair dryer up the nostril.
Oh, I was going to ask you about the hair dryer up the nose. That was my next question.
None of those are going to hold any relevance or credibility. They're not going to help. They're not going to prevent the virus from spreading. If you do get sick and have got respiratory disease,
right,
then we're in a different page, and then you're going to need other stories and you're going to need other help. And maybe then together with your physiotherapist, you can do different types of breathing exercises. But if you have got no respiratory affectation and you're not extremely sick, there's no point in doing these things.
Right. So curling tongues up the nose as well, not necessarily a good idea.
Try it. Do a randomized double-blind control study and get back to me.
Penny wants to know, are there long-term, are you seeing, or are we seeing long-term physical damage from people who have recovered from COVID?
So there are new studies out showing there's a post-ICU corona affectation where you do get neurological affectation. There's a lot of depression, emotional affectation, and as well as weakness, fragility, fatigue, and that sort of thing. We also are seeing in people who have been ventilated for long periods of time, they do undergo a process of lung fibrosis. So they get scarring in their lung tissue, and down the line, they do develop problems with their breathing. But that's people who've been ventilated for long periods of time and people who've been in ICU for long periods of time. So yes, there is affectation post being affected and being critically ill.
Right. And a few people asking, Lisa asking, and Brenda asking similar types of questions. Can prepared foods, especially cold raw foods like salad or sushi, carry the COVID virus? Brenda's saying, should we be sanitizing our groceries as we bring them inside? I know this question keeps coming up because we're not really sure how to handle this.
We don't believe that food transmits the virus. We do believe that people transmit the virus, but foods, whether raw, processed, we don't believe there's a difference in that passing on the virus. You should sanitize your hands, you should sanitize the packages that you get when you get them, and take care from that point of view. In essence, if you are deciding to get takeaways, you are trusting that establishment that they are sanitizing and they are doing all the correct measures in order to pass the food on to you.
Right, and I'm sure that most of the restaurants are taking tremendous care. So probably from a takeaway point of view is
correct.
Probably okay. Stephen says, with regard to the possibility that shul, minyanim, and houses of worship resuming at the beginning of next month, what about things like gyms? Well, I suppose you want to go back to mention the house of worship as well.
That's a very contentious issue for me. I don't believe we should be opening up shuls. I don't believe we should be opening private minyanim. How can we open these things now in the spite of the sparking virus, in spite of the many people of the community getting affected, in spite of the fact that we're going into winter now? The minyanim or the private service will not be able to held outside. They'll be held indoors. People will transfer things to each other. People will inadvertently push their masks down. People will socialize. It is a very bad idea. So if we answer for gyms, it's not a good idea at all.
Mm-hmm. And Carla says, when can we expect the peak, or when can we expect the decline? Because we have seen this around the world, that it reaches this incredible peak and then it starts moving away quite quickly. When do you think this is going to happen?
So we initially thought the peak would be sort of middle to end of August. We now believe the peak's going to come middle to end of July. It's rapidly growing. It's rapidly spreading. And the virus doesn't just stop. When it does happen, it will plateau for a while and then hopefully start descending and rescinding in symptoms and the variability. But we are going to see a massive influx, and numbers are going to go up exponentially. We're going to be seeing over 155,000 cases, which has been sort of prophesized by the 15th of July. We are going to see multiple increases. Once again, this is not fear mongering. This is facts. This is reality, and it doesn't mean that everybody who gets ill with corona are going to be critically ill and need to go to hospital. 85 to 90% of people will be able to stay at home and look after themselves from home.
Well, we see a lot of those types of comments, that doctors are fear-mongering, politicians are fear-mongering, people in the media are fear-mongering, that they are, and to some extent that it's self-serving. What is your response to that?
Look, I'm on the forefront. I am seeing people in ICU. I'm seeing people who are sick. We are seeing critically ill patients. We are seeing patients that do not make it through this. We are not fear-mongering. This is reality. Anyone who thinks that doctors are trying to fear-monger and keep people away from each other. Why would we try and keep people away from each other if we were just fear-mongering and trying to make more money? It's all about protecting people. My rooms are exceptionally quiet at the moment, as many of the GPs and specialists around the country. People are quiet. People are not going to see their doctors, and rightfully so, unless you're ill who have chronic conditions. But this is not about fear-mongering. This is about reality. This is coming soon to a theater near you. This is coming to everybody. There will be somebody that knows somebody. Everybody will know somebody that has got the disease, and most people will get the virus despite you taking care. But it doesn't mean that the virus will cause you to land up in ICU.
I know that you've said a number of times that schools should be open. Considering the growth in the community, I happen to think, and that's my own view, is that we should consider closing schools until we pass the peak, which will hopefully be in the next few weeks. What is your thought on that?
So we've got to understand something. Schools are the safest place at this point in time for our children to be. Why? Because if you send your children home, they're going to end up having play dates. They're going to end up going to their friends. They're going to end up going to their cousins. At the schools, there's social distancing, public distancing. The children are in a safe environment at this point in time. What we're seeing, and I'm talking from the private schools at this point in time, is none of the children in the schools have got COVID. Some of the parents have got it, and then each classroom is like a bubble, and they're closing down their classroom to clean out the classroom and not worrying about affectation of the children spreading it, because the children are not super spreaders. So at this point in time, I do believe the schools are very safe. Whether the schools are a ability and probably a reality when the virus spreads more. But at this point in time, I still believe it's safe to send our children to school, my children included.
Right, and just can we just talk again about the super spreader versus normal spreader? Because it's very clearly some people or some cases are spreading it a little, significantly more than others. Do we have any further information on that?
Once again, children are not super spreaders. The amount of spread from children is very variable, but very minimal. A super spreader is someone who can spread the virus at a rapid rate. They talk about super spreaders for influenza. We are not talking about super spreaders here in the COVID virus. We're talking about people spreading the virus because it's a rapid virus, it's a progressive virus, and it's an easily transmissible virus. So if you're in contact with somebody who's got the virus, the chance of it spreading, you go by the R0 number, which is 1 to 2.5. There's a high rate of transmissibility of spreading this virus.
Abby wants to know, aren't we reducing our immunity by wearing masks and washing our hands all the time?
Not at all. We're protecting ourselves. We are looking after ourselves, we're protecting the spread. If we look at people in hospital at the moment, at this point in time, June, the middle of June, our hospitals are normally full with influenza patients, with other bacterial pneumonias. They're not at this point in time. Why? Because we're protecting ourselves. We're washing our hands. Doctors, nurses, porters, staff, everyone is wearing masks, cutting down on transmissibility, not only of viral infections, but of bacterial infections.
Can we just talk about treatment, dexamethasone?
So there's a big hype about dexamethasone. And yes, it is important, but we are part of an ICU consortium in Gauteng, led by Professor Guy Richards and Mervyn Muir, who have been advising us for the last 5 to 6 weeks already to be using drugs like dexamethasone. So we are very privileged to have been using this. Now, the dexamethasone we're talking about here is a drug that is to be used in hospital only and not at home. It has deleterious effects if you use cortisone at home if you're not sick enough to be using it. And it should be only used in patients who are on oxygen. There's about a 35% decrease in mortality rate of people using dexamethasone who are on oxygen in hospital. There's a 1 in 8 decrease in mortality in people who are ventilated, and a 1 in 25 decrease in the mortality in people who are on high flow or on just regular oxygen in hospital. But do not use it at home as a home-based therapy.
Right, and we're seeing some interesting things. I don't know if you've seen Times of Israel and a couple of Israeli publications talking about a breathalyzer test that'll give an instant result in terms of positive or negative cases. Have you been following the story?
I have been following the story, and we'll get to that in the good news part of our section. But I think there's other new treatments that we're also finding out about. There's an experimental drug called TXA-127, which is the pharmaceutical version of angiotensin 1 to 7, which could help protect our lungs. There's also a new study that suggests that people who develop antibodies after becoming infected with the coronavirus may not keep their immunity for more than 2 to 3 months. So these immunity passports that people think they've got might not be relevant, and only time will tell when we realize how long the people's immunity will stay with COVID-19.
And that's, of course, very relevant around a vaccine as well, because that's one of the tests, is to determine how long people have some form of immunity for.
Right, 100%. And if you look at the flu vaccine, when you have the flu vaccine, it basically gives you immunity or protection against that virus for a season, not forever. So you can't just have the flu vaccine once, whereas the pneumococcal, the pneumonia vaccine protects you for 5 years, and it works on different types of antibodies.
Right. That really those are really the questions that people are looking for. What do you think is going to be happening in the next week, and what do you see as positive news around this?
I think in the next week, the cases are going to ramp up dramatically. If we saw 4,000 cases yesterday and we saw 25,000 cases in the last week, we're going to be up to 30 positive, more than that cases in the next week or so, depending on how many tests we've got available and depending on whether or not the government decides to stop testing in Gauteng for every single patient like they've done in Western Cape. Now, from a good news point of view, you brought it up. The Israeli Ben Gurion University has developed this breathalyzer, which basically gives you an instant result within 1 minute. So within 20 seconds, and then it gets confirmed, you can get a result on a patient, which they're busy testing at this point in time, which will be groundbreaking because it not only picks it up in symptomatic, but in also asymptomatic patients. And this thing can be used at airports, it can be used at other ports, it can be used at shopping centers, it can be used at border control. This will be groundbreaking and revolutionary. And so to end off with my normal fiasco, I say dance with fairies, ride a unicorn, swim with mermaids, and chase rainbows. And as Dr. Seuss quotes, I love nonsense. It wakes up the brain cells. Fantasy is a necessary ingredient in our living. Stay safe. Stay away from the stigma. Stop looking badly at people who are infected. Help them. Praise them. Thank them for coming out. Be safe. Wash your hands. Hand hygiene, social distancing, public distancing. And if you do get the virus, you'll be okay. Stay at home. It's only a small % of people who will get severely affected. Stay at home and be safe.
Dr. Anton Meyberg, thank you. As always, good luck for the week ahead. It certainly, for you more than for many of us, is going to be a challenge. It continues to be. I'm Howard Feldman. This is the Synthesis Sunday podcast. We come to you each week around about this time where we answer your COVID questions. Stay safe, stay healthy, and wash your hands.